Okay,
All right, guys.
number three. Let's go.
All right, number one. A history reveals that a patient virtually stopped eating 5 months ago and lost 25%, wow, of their body weight. The nurse says, describe what you think about your patient, about your present weight. I'm sorry. Describe what you think about your present weight and how you look. Which response would be most consistent with anorexia nervosa?
Ooh,
I'm fat and ugly.
yeah, I think it's the
I
first
would
one, right?
think so.
Because they have like self-image disturbances.
Yeah. That would make sense to me because
Okay.
I'm trying to think if because I remember one of them being like them not thinking that they have a problem.
Oh, it's not D. It's not
You know what I mean? Like,
Yeah.
B. Yeah, no, that's, I mean, if you look at the other answers, I mean,
yeah, I guess that's true.
positive, positive, this is negative image. All right.
Yeah. Yeah. Because people with or patients with anorexia nervosa, they tend to have like a self-body
Yeah.
or self-image disturbance, I should say.
I'm sorry, I read one of the other ones kind of wrong, so ignore me. So number two.
The nurse
Yeah.
recognizes which of the following as an element of maladaptive grieving, but not normal grieving.
So not anger, sadness, or crying, because those are
Mhm.
normal aspects of grieving.
True.
What are
Somatic complaints.
somatic complaints?
So somatic complaints would be
I'm gonna Google this because I don't know.
it would be like psychological symptoms, right?
Hmm.
Maladaptive. What is it? Maladaptive grieving.
I found for maladaptive grief, when the loss disrupts the individual's sense of self. So
So loss
I
of
think loss
self-esteem.
of self-esteem. Yeah.
Yeah.
There you go. See.
All right.
Great.
An alcohol-dependent patient admitted yesterday believes the window blinds are snakes trying to get in the room. The patient is anxious, agitated, and diaphoretic. What type of medication can the nurse anticipate the healthcare provider will prescribe? My first thought is B, an antipsychotic, because the blinds are snakes, but
Yeah.
Mm,
I agree with that, Sydney.
Mhm.
So the patient is delirium, right? Delirious.
I think they're anxious, agitated, and diaphoretic. Alcohol dependent. The windows are trying to get in the room. Do you
Would it
guys
be a
think you need a
benzodiazepine?
sedative?
Yeah, that's kind of
I feel like
because
maybe
they're not. Sorry.
no, you're fine.
It's not D. It's not gonna
No,
be
it's not a no,
No,
and it wouldn't be a monoamine oxidase inhibitor.
no, it's not.
Either.
so it's
But the
not
reason I'm not sure if it's an antipsychotic is because those are not psychotic
I,
symptoms.
I read benzo.
I think a sedative might help.
What do you think, Sydney?
No, I agree. I agree. That was just my
Oh,
first.
yeah.
Because
That was
yeah,
mine
because the
too.
hallucination.
Mhm.
so we're
But
gonna
yeah,
give
because the
But I
alcohol dependency is causing.
that's what yeah, that's what's kind of getting me.
Oh, sorry. You hear that?
So
so we're gonna go with A.
Yeah, I
yeah,
would say A.
Yeah, let's go with A.
What the heck is that crying, bro? What you got?
That's my dog. He's
it's his
got his toy.
dog.
Oh, well, put him in your lap so he would stop crying.
No, it's so
All
question
right.
4. A nurse reviews vital signs for a patient admitted last night with an injury sustained while intoxicated. The medical record shows the following blood pressure and pulse readings. What is the nurse's priority action? So an injury sustained while
Okay,
intoxicated.
definitely not a restraint.
No.
Definitely not fluids. I mean,
I would say
Well,
B.
but if they're drunk, oh well, it was last night. Are they still drunk? Probably not.
rate is good. I mean, it's going up. So blood
Yeah.
pressure and heart rate's going up. You know what? It might. Hold
That's
on.
why I think it's B, right? Because their blood
Yeah,
pressure
I
and
would.
heart rate has continually increased.
Mm-hmm.
Okay.
And over an 8-hour period, their heart rate has jumped what 20 beats per minute, and the
That's
blood pressure has jumped 30.
I'm
There's
gonna see if I can find anything because that one
Something's
is.
going on, but
Go ahead. Go ahead.
so what do you think? We're gonna stick with B for now?
I think B.
Yeah, I'm leaning B, just because.
Okay. I'm finding consult a provider.
Okay.
So yeah. So B.
All right. A divorced
All right.
woman tells the nurse that she has been self-medicating with cocaine to deal with loneliness and depression. Which term reflects the client's current state?
My first thought is psychologically dependent because those are psychological symptoms.
That's what I thought.
Mhm.
But
Yeah.
post coke
I know.
blues and overly aggressive. No,
What?
that's
All right. A sounds good to me.
You guys think A?
I think A.
Self-medicating
Yeah, I mean,
for
yeah.
loneliness and depression. So yes, she's
Yeah,
psychological.
and the Coke gives you like, that like high or,
I'm just gonna Google. You can move forward.
go
Post
ahead.
coke.
It's okay.
Post coke.
Um,
It's such a thing.
which term describes the controlled administration of a chemically similar substance to thwart the effects of substance withdrawal? Pretty sure it's detoxification therapy.
It's a controlled emission chemically similar towards. Yeah.
Controlled admission of a chemically similar substance. Yeah, detoxification.
Detox.
yeah.
Right? Like
Or
it's
is it
like
substitution therapy? I thought it was
Detoxification.
because I thought substitution therapy was when they're interacting or they're introducing another substance to counteract the first one.
I I don't know. I'm gonna look this one.
Did I read that wrong? I thought it was
Yeah, I thought it was substitution therapy. Because it replaces the substance of abuse with a chemically similar but less harmful
yeah.
substance to manage withdrawal syndromes and cravings.
Oh, okay. So you said what is it, Sydney?
D delta.
Oh, okay. So substance, yeah.
You confident about that, Sydney?
I mean,
For
yeah.
number 6.
I mean, I feel like both could be. So
Yeah, I could see detoxification.
But it says chemically similar substance
Yeah.
substitution therapy. It
And
says
what I think of when you have these people who are, heroin, they take, what is it? The other one,
The antidote.
not the antidote, the other one that to kind of wean him off of it. Oh my God, methadone.
Oh, you're right. It is no. Sydney's right.
Right.
It's substitution.
Okay, there we go.
It's substitution.
Okay,
Yeah.
number
Okay,
7.
7.
in
In
addition
addition
to,
to, sorry.
no,
In
you're
addition to diaphoresis and tremors, which symptoms would the nurse expect to see as a client undergoes alcohol withdrawal? Oh, alcohol withdrawal. Pretty sure tachycardia.
yeah, I
You-
didn't read
Hypertension.
Is it hypertension or hypo? I
I'm
forget.
gonna look because I
Hyper.
just had this in my
Is it
notes.
hyper? I know it's tachycardia, but I don't remember which one.
The withdrawal. Where are you?
I feel like
I think
Gotta be
hyper sounds like it would make sense because when you stop alcohol consumption, I thought
Oh, no.
is it hypo?
Oh no, I'm sorry. I'm looking at anorexia. I need alcohol. So how many hours after is this?
It doesn't say.
Okay, well there's tremors, we got anxiety, blah blah blah, hallucinations, delirium, excessive sweating, disorientation. Hold up. So signs of withdrawal of opioid abuse is tachycardia, hypertension, hyperthermia, blah blah blah. I don't know why I'm not finding this of
Yeah,
alcohol. Wait, what is wrong? Anxiety, nausea, abdominal pains, alcoholic hallucinations, seizures, delirium, withdrawal, medications, delirium.
So it's definitely tacky.
I think Sydney's right. I think it is. Yeah, it's definitely tachycardia. I think it is hypertension when they quit alcohol because when they're consuming the alcohol, I thought they have a low blood pressure, but I
Yeah.
might be wrong on that.
Yeah, no, I think you're right,
I thought
man.
they're hypo when they have like when they're drinking a lot. It tends to lower the blood pressure,
Oh, maybe you're right.
but then when they stop drinking, their blood pressure goes back up.
Right.
So you do think it's hypertension?
Yeah, it says it right here in WebMD. 48 to 72 hours, high blood pressure,
Okay.
racing heart.
Question 8.
Okay.
2 hours after admission for alcohol addiction treatment, a client tells the nurse, "You know, I haven't had any real food in 3 days." Assessment reveals blood pressure 170 over 100, pulse 110, respirations 28, temperature 97 degrees with dry skin, dry mucous membranes, and poor skin turgor. What is the priority nursing diagnosis?
Imbalanced nutrition.
Yeah, because they haven't had
Mhm.
food in 3 days.
Yeah,
Yeah.
it's definitely, yeah.
Knowledge
it would
deficit.
No
be
coping.
fluid excess. Yeah, it would be
Mm.
low fluid.
And it's not that she's deficient knowledge, like she knows
Yeah,
they have
So
not had
that's so
food
C
and
is the most is
because it wouldn't be fluid volume excess. They wouldn't have dry mucous membranes. They
yeah,
would be moist.
that's dehydration. So
Yeah.
okay.
I say C.
Okay.
Okay.
Fine.
Which
Which process must be completed by the nurse before caring for clients with substance abuse disorders?
B?
Bravo? Is that Bravo or Delta?
Bravo. Process their own attitudes and perceptions. I feel like that's a process that must be completed by the nurse before caring for clients with substance.
Yeah.
So by the nurse.
Yeah, it's the bias. You have to,
Oh, yeah.
yep,
Okay.
I think so.
Which process must be completed by the nurse? Process by the nurse before caring for clients. Before. Oh, yeah.
What are we thinking? D?
Yeah.
I mean I
B is
could
in
see
Bravo.
that.
B, Bravo. Yeah,
B?
B.
Okay.
Yeah.
Because I'm getting stuck. I'm not stuck, but the before caring.
Before, yeah.
Before. Not during, not after. It's
Mhm.
before.
And
Right?
you, I mean,
I mean,
I like
we
here's the
can
thing, you want to always avoid being confrontational with any patient. Like there's, you know what I mean? Like even if they start fighting with you, whatever. You do want to encourage them, to identify roles, but then at the same time, like they might think like, oh, I could put the blame like on this person. Like, oh, like my friend always drinks and they always give me a drink. And so like I don't want them to be, so then it's like you're still like not really letting them like recognize that they have a problem. I don't know if that's like on you to do or whatever. So like that makes sense, but also, I do understand that. Recognize that their personal potential for addiction is very low. I don't really know what that means. Like your own? Is that what that means? Like I don't really know what that means.
to me B and Bravo is the one that
Yeah,
makes
I
Yeah.
think that makes the most sense.
Mhm.
okay.
I agree.
All right, 10.
A nurse is obtaining an admission history from a patient who has been abusing drugs and alcohol for years and has lost his job several months ago. His wife recently left him and is now living with her two children at her parents' house. He tells the nurse, "I would use drugs and booze if my wife hadn't been nagging me all the time to get a job. She never did think that I was good enough for her." How would the nurse interpret this statement?
I think he's just under a lot of stress.
Mm-hmm.
But I would also say
I'm
he's in
going
denial, right?
Bravo.
He
Yeah,
could be in denial, but
Because
oh
to me, it sounds
wait.
like he's more in denial about
because I wouldn't
Yeah,
I
yeah.
wouldn't use drugs and booze,
wife
right?
hadn't been nagging me really. Come
Yeah, yeah.
on, bro.
Because he's been abusing drugs and alcohol for several years.
Yeah.
has lost his job several months
Oh,
ago.
I forgot that. I
Now-
forgot that
yeah.
part.
No, you're right. Do you guys think it's Bravo or Charlie?
Bravo.
Yeah.
Yeah.
Bravo.
All right, that's why we hash it
Don't
out, man.
listen to me.
Exactly.
Next. A male
Uh.
client is brought to the emergency department because of aggressive behavior, slurred speech, and impaired motor coordination. His blood alcohol level is 347. Yeah. The nurse understands that the minimum blood alcohol level of intoxication is what value? Somebody Google that because I don't know.
Yeah, I don't know.
There.
Minimum value.
I don't know.
So blood level of intoxication, I'm getting percents of BACs.
Milligram per, was it deciliter?
Yeah.
Yeah. I
BAC.
need like blood like serum.
Oh, that is serum, ain't it?
Is it 100?
That's what I was thinking, but
Okay, so serum levels of alcohol between 600 and 800 are often fatal. Between 400 and 799 blood alcohol level, the onset of alcohol coma can occur. Between 200 and 399 are associated with nausea, vomiting, marked ataxia, and hypothermia. So that's probably like you're like really, really drunk, you're blacked out. So I think 200 even is high.
Does it
So
say
I'm
what the
thinking
minimum is?
I'm thinking A or B.
Oh, so
The minimum.
yeah.
I would say I think 100.
I
The bare minimum.
I mean, depending on what the minimum is.
yeah,
I mean,
what's the
what
minimum?
minimum?
Stop showing me the legal limit. I know what this is.
Okay.
Why
Blood.
is this so difficult?
Oh, okay.
Found it?
It
Two-
says mild effects may occur. Oh shoot, maybe now I'm confusing.
Okay, this is a psych page on alcohol intoxication. And it just said, great, where did it go? Come on, man. Hold on. Don't do this to me. Why are you doing this to me? Okay, hold on. Okay, blood level and associated symptoms. So serum blood symptoms 250, needs assistance in walking. And then it like cuts off and now I can't find it in here.
You guys
Okay,
want to
needs
come back to
assistance
it?
walking, total mental confusion, non-tolerant individuals are likely asleep, dysphoria with nausea and some vomiting can occur. That is at 250.
I found 100.
Yeah, me too.
Okay.
Yeah, less than 50 is you're not considered intoxicated.
Yeah, this says like, yeah, so 40 to 60 I found well-being, feeling, relaxation, lower inhibitions. So 100 is minimum.
All right.
Okay.
Somebody read 12.
A teenage female client is admitted to the adolescent unit of the psychiatric hospital for observation, diagnosis, and treatment of possible anorexia nervosa. She is 65 inches tall and weighs 85 pounds. On admission, she tells the nurse, "I don't know why my parents admitted me. I'm just trying to lose enough weight to stay on the gymnastics team." Which of the following is the priority nursing diagnosis?
I'd say ultra nutrition. She's
Oh.
only 85 pounds.
Yes.
And that's for 65
Yeah,
inches tall.
that
That's very.
Yeah.
I agree.
She didn't say anything about her altered, image, body.
Yeah. And
Mm.
she's claiming nothing's wrong. So she's not having a self-esteem disturbance. I don't know why they brought me here. Like, I'm just losing some weight.
Yeah. All right. So Charlie.
Cool.
13. The nursing diagnosis for a patient with bulimia nervosa is ineffective coping related to feeling of loneliness and isolation as evidenced by use of eating and induce vomiting to comfort self. Select the best 2-week outcome related to this diagnosis. Ah,
I think
Oh, so it's like
different
a
methods
SMART
of
goal.
coping.
Yeah,
Yeah,
I would,
two alternative methods of coping. Yeah,
Yeah,
because
because
it's
you
like a
want them,
SMART goal,
because
Paulo. If you remember those,
the what?
like a SMART goal, like where you're setting goals like
like
weeks
they're
out.
sizable, they're
Oh, yeah,
attainable,
yeah,
you
yeah,
know,
yeah, yeah.
time. Yeah.
mhm.
Oh, I agree. I agree with that.
All right. 14. Family dynamics are thought to be a major influence in the development of anorexia nervosa. Which of the following does the nurse recognize as descriptive or common to an anorexic client's home environment?
Hmm.
Mm,
I would say overprotection and perfectionism could definitely be one.
Yes.
That's what I,
Paternal abusiveness could be one too.
Same with B.
Yeah, I mean,
Ah,
well, an overemphasis on food, I feel like might
yeah.
lead to almost like a
bulimia or not?
yeah,
Binge
maybe
eating?
maybe that because like
Yeah.
they feel pressured to eat, and so they want to eat and then they go purge. Um,
Yeah, Charlie for me is the perfectionism.
Yeah, that's kind of how I'm
I
leaning
I
too.
feel like that does make a lot of sense.
Yeah.
Um,
Okay.
oh, I actually found this right here.
Because I thought, like in
Yeah.
adolescence, especially with anorexia, they're like, it's almost like a way to rebel against like the parents, as
Mhm.
a means for like the child or the teenager to get control.
Yeah, I found a little like rationale for it. So the nurse should assess the home environment that's overprotective and demands perfection, because it could be a major influence. So if there's distorted eating patterns, they may represent a rebellion, like you said, there you go, against
Okay.
parents as a child's means of gaining and remaining in control.
All right.
So C.
All right. 15.
what rationale explains why inspection of the teeth and gums of a client with bulimia will most likely reveal deterioration?
The
A.
high acidity of them. Yeah.
Acidity.
Yeah.
Oh,
So A, right?
Yeah.
Yeah, Michelle, you should know that one.
I know I was gonna say the enamel on anything that says enamel being like eroded. Yeah.
High
Yeah.
school senior suffers from anorexia nervosa. As class valedictorian, she achieved a perfect score in her SATs and has been offered a full college tuition scholarship. She recently collapsed during cheerleading practice and was hospitalized for severe malnutrition. Her treatment team is planning to use behavior modification. The nurse determines that the success of behavior modification is based on what principle? Principle. Oof. So behavior modification. Motivation?
Mm,
I'm thinking maybe reward.
Behavior modification.
I don't know.
So that's some behavior modification.
I feel like behavior modification, I guess relies on positive reinforcement, which would involve
Reward.
rewarding desired behaviors.
I see.
Yeah,
Yes,
that makes sense.
increase
Wait,
like
what
more
does it say?
of that behavior.
High school senior.
Our treatment team is behavior mod. How do you modify behavior? Yeah, I mean,
With
yeah,
reward.
Or is it, once again, is it that control that we were talking about? Where
definitely.
they're like trying to get control.
Mm.
I
Remember?
know.
Let me see. Behavior modification.
Behavior modification.
This one's a hard one because
It could be a lot. I
Is
mean,
it? Yeah.
yeah, I mean, okay, so so she's a straight A student, full ride scholarship. She collapsed during practice, malnourished, so she's super malnourished. Oh God, but I don't think it's motivation because I don't think it's not like she's overweight, you know what I mean? And it's not like, oh, you need the no motivation, like you could work out and we're gonna fix that, you know what I mean? Like that would be more so for maybe like a patient who is like very like morbidly obese or something like that. And like they kind of
Mhm.
need help with motivation to, want to live basically and lose the weight and stuff like that. This poor girl is anorexic and malnourished, and I could see the control thing,
Well,
I
but
what
I don't
The
think
control.
like
I
uh-huh.
found behavior modification uses four components to shape and reinforce behaviors: positive punishment, negative punishment, positive reinforcement, and negative reinforcement. So,
Okay. Protection, I don't think that makes sense.
No. But what would be
God, I just
what
like
would
don't
behavior
know.
modification rewarding be? I'm trying to think.
And like, how would she
I don't know.
benefit from that? Like, how would she be better from over what, you know what I mean? That's like
That's
basically
yeah.
someone's like, hey, like
So
if you
what are you
go to
two?
therapy, you know, we'll give you this. And
So what are
like,
you leaning towards, though, Michelle? And
I don't know.
okay,
Maybe
let's move on.
control.
I
The
think
reason-
I'm leaning more towards control now too.
The
Okay.
reason I
Just
said
because I'm
control
wondering
was
if they want to like be like, listen, like we need to get this under control. God, no, like because I know they don't
Well,
mean it like that. Like
yeah.
not that they need
We'll
to get it
come
under
back to
control, but
it.
it's like,
The reason
Well,
I
I
said
think
control.
control because let's read it back. It says class valedictorian.
Yeah.
She achieved a
Yeah.
perfect score on her SATs and has been offered full college
Mhm.
tuition.
yeah,
So they
Yeah.
want to give her control back of like her life
of her own self. Yeah.
Yes, that's
Okay.
kind of how I thought with the behavior. Like she would get control of her own behaviors.
Okay, so
That's kind
I
of
Charlie,
think
how I
that's
was
pretty,
looking at it.
yeah. I think that's
Okay.
pretty good because look at all these oh, perfect. Ready? Look at all these rewards that she already has.
Exactly.
A free ride, a perfect score on her SAT. She's on the cheerleading team. You know what I mean? She's valedictorian. She has all the rewards and she's still suffering.
all right. So Charlie,
Yeah.
17, go.
All right. One bed is available on the eating disorders unit. Which of the following patients should be admitted? I'll just read these. So weight drop of 150 to 102 over 4 months, 96 temp, 38 beats per minute, blood pressure 64 over 42. Jesus. Weight 120 to 90 over 3 months, normal temp, 50 beats a minute, 70 over 50 blood pressure. 110 to 170 over 4 months, normal temp, normal beats, 80 over 66. And then 90 to 78 over 5 months, normal temp, normal beats, 74 over 80, over 48.
Like all of them should be admitted.
Literally all of them, yeah.
I feel like for me, the first or second though,
That is, I would go with the
Like it has
most,
the most
the
weight.
first one to me, yeah.
I would go,
Also,
yeah, with the
the
most
first one, 48
drastic.
pounds lost over 4-month period. So they're losing 12 pounds a month. They have a lower blood pressure, lower heart rate, lower
The
temperature.
heart rate.
Good point.
Oh, honestly, the heart rate in and of itself is,
Yeah.
that's ridiculous. That is crazy.
Okay,
And the blood pressure is severely hypotensive.
I agree. Anybody disagree or have any other alternative?
Oh, I think A.
18, an adolescent is being evaluated for bulimia nervosa. Which information from the client's history supports this diagnosis?
Vomits after eating.
Yes.
Mhm.
Exercise.
Hates talking about food. Oh, actually,
Those in periodic eating binge.
I feel
Would
like
that
with
be someone with
bulimia, you
bulimia?
wouldn't hate talking.
You don't really care because like you're eating and you're
Right.
just gonna go.
All right.
Do they binge? I think.
Minutes. So, bulimia? Yes, they do.
Yeah,
Yeah, they do.
I think so too.
No, they do.
So
Yeah.
1 and 4.
So
So,
1, 4, and 5. I'm sorry.
Oh no,
One-
you're right. No, you're right.
yeah.
Oh, I am right. Oh, okay. Yeah, look at me. Go my eyes. 1, 3. No, 1, 4, and 5.
No, yeah, you had it right the first
God.
time.
Yeah, one.
All right. 1, 4, and 5.
1,
Okay.
4, and 5.
19, go. Somebody.
Treatment team working with a teenage client who has anorexia calls for a family meeting. The client's mother asks the nurse, "What is it that you want to ask us? My daughter's problem has now become this family's problem. We are tired of dealing with her issues. Which of the following is the most appropriate nursing response?" Not the first one. That's
No.
just antagonizing the mother.
Ooh, I like B. Bravo.
Yeah,
Yeah,
I'm like
B.
2.
Yeah, eating disorder. Yeah.
Okay.
Yep.
Yeah.
20.
Concerning meal times, which intervention is appropriate when the nurse is working with clients with eating disorders?
Read this before.
Mm,
B, right?
I think,
And don't you want them to, I think, take a journal, right?
But it's not
Yeah,
chart.
but like,
yeah,
but why would you give them nutritional information such as calories, fat, grams, and carbohydrate amounts?
oh no. Well,
Oh
so
yeah.
Would it be A?
Stay with the
yeah, because I actually see this says like structuring meals, decreasing discussions about food. Because they'll like decreases like power struggles with the
Mm.
patient, so they'll avoid manipulative games. But it does say, oh well, this is as appropriate, but provide smaller meals and like supplemental snacks.
So A sounds the
So
best.
yeah, because you don't want to restrict them and you don't want to like sit with them like, oh well, oh no, that they stashed food. No. I think you should stay with them during their meals, allowing them to take as much time as they need. You know what I mean? This one seems like the most helpful to the patient rather than harmful.
No, I agree. Yeah, I agree
So
with
A.
yes.
All right, 21. A client calls the eating disorders clinic for an appointment. She was hospitalized and diagnosed with anorexia nervosa when she was 14 years old. She is nervous about starting a job and wants to perform perfectly. She tells the nurse that she has been taking laxatives every day and that some days after eating, she self-induces vomiting. She is 5'6" and weighs 105 pounds. What other physical manifestations might the nurse expect to find upon assessment?
Probably hypotension.
Hypotension, yeah,
I would
hypotension.
think so.
I think Brady cardia.
Mhm.
What is polyuria again?
So you peel up
Frequent urination, right? Polyuria.
Is it?
poly. Well,
Or is it just
I
excessive
thought
urine production?
oh yeah, okay, yeah. I thought it was just excessive urinating.
Yeah, you're
Yeah.
right.
so
cool.
second and
Um,
third.
well, the laxatives, I mean,
But look, she's gonna have
That's-
imbalanced nutrition, right?
yeah,
The vomiting, the laxatives.
I don't think, I mean, if anything, I think the temperature would be lower. I don't think she'd have a fever.
Right.
So
Right.
I think just hypotension and bradycardia.
Agreed.
Sydney?
I agree.
I agree. No, I agree.
Yeah, cool.
All right.
22?
Go.
Oh, these all that apply. God.
Mm-hmm.
All right. The nurse is caring for a client with anorexia nervosa and bulimia. Oh my God, you poor soul. Which intervention should be included in the plan of nursing care? Okay, absolutely not the first one.
Mm-mm.
Yeah,
No.
no.
Definite. Well,
The third one.
Not the second.
Yeah, not the first, not the third.
the
You don't think
second,
you don't think the second?
the second
You want to be
maybe because
consistent?
but sometimes I think it's not for that. I think it's so they can't play like games with you. Like it says to prevent manipulation. So it's like, if they secretly, like stash food or like secretly don't eat it or
Or
they
purge,
secretly
right?
go purge,
Oh,
this
yeah.
you're
Yeah.
like, I'm gonna get you whenever. I'm gonna weigh you whenever.
Okay. So second, and what else did you
The
say?
last one, right?
The last one, yeah.
We just talked about,
Advice,
supervising
yeah.
them.
Okay.
And
Good.
yeah, I mean, I don't think
So
Well,
You
we
don't-
just talked about,
you don't
don't want to be discussing food, eating, weight, and exercise.
yeah.
okay, so just those two.
Or do
So
you,
just
yeah.
those two, yeah, because they're anorexic and bulimic. So
You don't want them to throw up, yeah.
Okay.
yeah.
All right. Next.
All right, 23.
The nurse recognizes that which characteristics is true concerning the Navajo Indians of the Southwest and their response to loss. I have no idea.
It's not B.
I'm gonna have to Google. I don't know.
I
Mm,
I believe it's the first one.
No.
Life.
do not express grief openly.
I might be wrong.
I feel like I should remember this from like 6th grade.
Oh, is it? Oh, maybe it is the second one.
I think from what I found, It says they don't express grief openly.
That's what I
And
found.
yeah.
Okay.
And they don't, because they don't touch the person for 4 days after death.
Oh, wow. Okay.
They wait to bury. So yeah.
So
Okay.
bravo.
Oh,
Yeah.
bravo.
So bravo.
Bravo. Yeah.
All right. We have 3 minutes 29 on this.
Okay, we can do one more
We could
question.
get a couple
Yeah,
No,
we
we
can
can
do
do a
it.
couple.
Okay, which behavior may be attributed to grieving at the adolescent level of development?
Acting out.
Adolescent. Yeah. That's what I did.
Is it acting out? I think so, right?
Adolescent?
I mean, it depends on the level.
When you're dealing with grieving.
This is an adolescent, so this is a school age, I think it would either be like they like socially withdraw, like I got like very quiet, like when I lost my friend in high school, I didn't want to talk to anyone. I mean, I will say like school was very hard for me to go to, so that's why like maybe like a little bit of C kind of gets me, and like clinging behaviors, like maybe you're like, oh my God, I need to be so close to all my friends now. I just lost one. And like, or maybe you kind of like retract a little bit
Yeah.
emotionally mature, like maturity wise, and maybe you'd cling to your parents a little bit. But as an adolescent, I guess maybe you would act out, aggression or defiance, sneaking out, drinking, in your friend's basement, like, I'm thinking about what I did. I'm thinking about what I did.
I'm just reading. I'm listening to you. I'm just reading.
Yeah, I don't believe it would be denial of their own mortality.
No,
Yeah,
it's too advanced thinking.
And usually adolescents, believe they're immortal.
Yeah.
Yep.
Yeah, it just
Man.
says, like, I don't know, like
Many
like emotional regression, sometimes even like bedwetting.
Well, it says here many.
If like losing a loved one, or
There's-
like a repetition of losing.
Oh, go ahead. So which one are we going with? Sorry, we have a minute left.
I don't like this question.
So we can pick one and
I'm leaning D personally.
Delta.
Yeah, Delta.
Okay.
all right, I'm gonna end. Michelle's stuck again. So
Okay.
so we ended
We'll
it.
pick back up on question 25.
Yeah, I'll give me like 3 minutes because this is the full 40-minute recording, so it's gonna